If you've been frustrated trying to get into your doctor's office, you get in weeks to maybe months later, you're not even seeing your primary doctor. You see the person for 7 minutes on average, and then months later, you get a surprise bill of $200 and you don't even know what it's for. If you've ever experienced any of those frustrations in the US healthcare system, this video is for you. I'm going to talk to you about what I think is a cure or solution in the primary care arena called DPC, or direct primary care, how it compares to fee-for-service and concierge medicine, some pros and cons, and how to find a DPC clinic near you if you are interested. If you are curious about any questions I can't answer in this video, or maybe I haven't even thought of yet, drop them in the comments below. If you found this video helpful, please like, send to a friend, and if you like this kind of content, hit that subscribe button. It helps me to know what people are interested in hearing more about. Without further ado, what is direct primary care? DPC, as you'll hear me reference moving forward, is a membership-based primary care clinic model. So we are not using insurance in the office for primary care services. So that is visits. We're not charging co-pays or a fee for a single visit. You're only paying your monthly membership, and this varies depending where you live and the cost of living in the area, from say $50 to $150. And you say, dang, that's a lot of money. Well, depending how many subscriptions you have and how you prioritize your health, it could be worth it if you're not wanting to keep getting charged a bunch of co-pays and keep going back, and have better quality of care and healthcare moving forward. So it's like a gym membership. You kind of pay for it whether you use it or not, but the hope is you are healthy enough where you don't have to use it a lot. The reality is we're there if you need us. It's easy to get same to next day urgent or sick visits. And even if you're just planning your routine follow-up, well woman exam, well child exam, what have you, it's so easy to access the doctor's office because they're usually small, very personable. Oftentimes they remember who you are and you're not just a number in the system, and things like that. So there's so many great things about DPC that I can say, and I'll save some of those more pros for the end. How does it vary from a traditional fee-for-service? Most people are familiar with this if they have some kind of insurance, whether it is private or government sponsored. You go to the doctor, you see someone who takes your insurance. That might change from time to time depending on how the system or insurance companies want to connect with each other from year to year. You get a set amount of things you need to accomplish per visit, and your things are billed, labs, everything with your insurance. You get billed weeks to months later of what they do, don't cover, what have you. So most people know fee-for-service using insurance. What people may not know the difference between DPC is with comparison to concierge medicine. A lot of people think that they are one and the same, but in fact they are different. Concierge medicine will charge you twice, if you want to think of it that way. You're getting charged to your insurance, but you're also paying a high monthly or annual fee for access to the doctor that accepts your insurance so that they can have a lower patient panel and more availability. So for someone who has more money in their pocket just weighing them down, and they want to continue to use insurance but also have better access to a doctor, concierge medicine might be something that they're interested in. And it's more popular just depending on where you live in the United States. But the key difference is really the cost is a lot higher compared to DPC most of the time, and they charge insurance. So I hope that clears up some of the confusion about the difference between DPC and concierge medicine. So let's go back to DPC. Some of the pros I've already mentioned. Longer visits, you get access to the same person pretty much every time. I mean, for me and the other physician that I work with at the office, we might see each other's patients if one of us is at a conference or on vacation. So that's just something that doesn't happen a lot, but it may not be 100% of the time, but much better than with a fee-for-service type of practice usually. Then you're not paying copays when you come in for a visit. So if I have a kid who I'm checking their ears and then a few days to a week later, I want to do a follow-up just to make sure everything's going okay before I go on a vacation, you're not getting charged twice just to come. And then we have the opportunity, if the chief complaint is appropriate, to do telehealth as well by phone or by camera within our electronic medical record. So that is really nice. Some other things people may be of interest is the in-house lab discounts and medication discounts. We can draw labs on site in our office specifically. If you look at another DPC clinic, they may or may not be able to do this. And then depending on the state, some clinics may not be able to have an in-house pharmacy like we do. We don't have everything in the in-house pharmacy. It's only 2 of us in the practice, so we're not a very big clinic, but we have your very basics, your everyday, run-of-the-mill primary care stuff. So blood pressure, cholesterol, diabetes, some things for diabetes, antibiotics, acid reflux, what have you. And then we also can order certain medicines too if it's something we can hold in our pharmacy and we notice for a patient it's cheaper and easier just to order it and they're wanting to get it through us instead of the pharmacy. Sometimes we can do that as well. We can't have controlled substances in the office, which probably is expected, but for patients, say ADHD, something like that, we'll just try to find the cheapest local pharmacy that has their prescription available and send it there. I can always send prescriptions out. They can choose to use their insurance or not, and then go from there. Some other pros, if someone needs a procedure, say we're gonna do a skin biopsy for a suspicious spot for someone who was previously a bit of a sunbather in their younger days, we're gonna put in a Mirena IUD, do a knee injection for some arthritis. There's no procedure fees. We may just charge a cash pay fee for a few bucks to cover the steroid that goes in the knee injection or to cover the pathology fee for the skin spot that we took off their arm, what have you, and go from there. We get a lot of transparency even for some of the things we send out, specialist referrals, imaging orders. If we're doing cash pay for a lot of those things, we have a lot of transparency in the cost, which patients usually appreciate, and they find that even if they have insurance, that it's so much cheaper to not use it, actually. So that can be surprising and revelatory for a lot of people, myself included. I'm always really surprised to hear the insurance cost versus what patients could pay if they're doing cash pay. Anywho, that's a song for another time. If you're someone who's interested and you're like, well, what are the cons? Well, like I said earlier, if you've been to one DPC, there can be a little bit of inconsistency depending on what clinic you're going to, of what they may be comfortable seeing, what services they provide, and their ability to do that. So you can always reach out to the clinic or maybe even stop by to visit or do a meet and greet before you sign up and just make sure you're comfortable with all the services provided, age groups that can be seen confidently by the doctor. If I was internal medicine, I would not be seeing children, but because I'm family medicine, I'm able to see pediatric patients, things like that. For a low utilizer of healthcare in general, they may not like the fact that they're paying twice to use or have insurance, say a high deductible plan and a clinic, but some patients do still choose to be a DPC member or patient because they feel like the access and quality of care, should they need it at some point, is really nice, and that it's much more affordable than a concierge type practice. Other cons, sometimes the communication between our office, at least, and some bigger hospital systems can be delayed or lacking a little bit. Because we're such a small office, we don't have a huge popular electronic medical record system. So for certain specialty referrals poor notes, it can be a little harder to get the communication circled back around for me to review and stay in the loop of. But to be honest, I don't feel like that's a huge issue because I am able to access read-only to some local hospital systems where most of my patients would go if needed. If you can think of any other cons, let me know. The nice thing about DPC clinics is that not only can you sign up as an individual or a family, but we also have a lot of self-employed or small business owners who send their employees to us as well as a health benefit that saves them a lot of money too, versus paying for a traditional insurance carrier who provides more expensive but maybe not as high of quality care to their employees as a health benefit. I hope this was really helpful, and stick around for future videos where we're going to cover more than just the landscape of medicine and primary care, but also certain topics of interest ranging from women's health to prevention and chronic disease management and more. I hope that y'all return weekly to see what videos we'll put up next.